no, I wish it would have lasted longer for those of us who are loving this course so much. But yeah, so we are towards the end. Today we are going to review for our very, very last quiz of this quarter. So that's exciting, right?
Yes.
All right, that's what I like to hear. Yeah, so what we have left of this quarter is we have about, 1.5 weeks left. So it's going to start happening quickly. I hope that everyone has their topics. If you have not, for your research project, if you haven't told me what your topic is, please tell me now, or send it to me in email. And if you need me to help you with anything, ask your questions like ASAP, okay? Because we need to, it's going to be, very, very, very soon is when everything is going to be due. Okay. And I also sent you guys an email recently. I hope everyone saw that. And that's just how I am able to record myself in a PowerPoint presentation. You guys, you're not restricted to doing what I did, but you need to do something. You need to be able to present your research project in some way. So you can go ahead and get creative and do something else. If something else works for you, you can even just set up a camera and present it like this or whatever. You can think of something else that you want to do. But if you wanted to do what I do when I present PowerPoint presentations, that was my instruction. So I hope you guys got the video. So we will not be having a Zoom meeting for our presentations. You'll just be turning in your presentation to me so that I can go through it and grade you and all that. And that's all happening next week. Okay, so I hope you guys are working on it. And if you do have questions, you need to let me know. Also, of course, today is when quiz 4 is opening. It's actually already open, or it should be. If it isn't, you guys can let me know. We're going to review for that. We're going to take it to today or later on in the week. As soon as everyone is finished taking quiz 4, I will update the grades completely. And for those of you who took all 4 quizzes, you will notice a significant increase in your grade. Okay, because like I said before at the beginning of the quarter, your lowest score will be extra credit. Okay, so only your top 3 scores will count for your grade. Your lowest score is going to be added as extra credit. So you're going to see that the scores are going to get a little bit scrambled. Okay, because everyone's top 3 scores might be a little bit different. So you'll have 3 quizzes, 3 quiz grades, and they might be out of order. And then you're going to have an extra credit quiz grade. Okay, so for those of you who took all 4 quizzes, boom, you will have instant extra credit and a significant jump in your grade. For those of you who only took 3, then nothing's really going to change. It's going to be the same thing. So there's that. Also, we do have our last few assignments, which are all just final exam review assignments. And then before we take our final exam, we will do another review just like this. Okay. And then we'll have the final exam and then we will be done. Also, next week I will open up all the assignments. So if you do need to make up any of your assignments, you can go ahead and do that. Okay. So anyway, do we have any questions? Anything? Nothing? All right. Well, if there is nothing left to discuss, let's go ahead and go. Let's move forward and start reviewing. Okay. Okay, let's start reviewing for our quiz. Let me go ahead and share my screen. This is not our quiz. Let me get Um, 3, midterm review, final exam, quiz 3. Where is quiz 4? Oh my gosh. I'm not sure if it's even on here.
Quiz 4 is on Blackboard.
It is on Blackboard.
Yeah.
Well, for the review for
Oh, okay.
yeah, for this class. I wonder if I accidentally labeled it wrong. No, this definitely looks like a quiz 3. What in the world? And then let's try this one. No, it's the same thing. Oh my god, do we not have one on here? I'm sorry, guys. Okay. So to review for the quiz, we may have to just go through the questions. Dang it. And this would be our quiz 4 review homework assignment. Okay, I don't think that it's going to be on here. I don't know why or what happened to it, but I think our plan B to review for the quiz will be to go through this review. Okay. And since that's the case, so what's going to happen is okay, we're going to have to just go through the questions. Okay, and you guys are going to have to answer the questions. Okay, so just go ahead and give your answers. We have 18 questions. Yeah, I think that's what we're gonna have to do. How do you guys feel about that?
Sounds like a plan.
Okay. All right then. So what's gonna happen is, yeah, we're gonna ask these questions. Or I'm gonna ask the question, I guess. So just go through them in order, and you guys will have to just go ahead and pretend you're raising your hand and just shout out the answer or whatever it is, and we'll just handle it like that. Okay, so for the first one, how are most of long-term care services for both community-based and institution-based services paid for?
You want us to raise our hand like that?
Sure,
That'll work.
that's good.
So, long-term care services are usually paid for by Medicare and Medicaid,
Mm-hmm.
and a small portion are paid through private insurances.
That's very true. Also, Medicare is not going to necessarily pay for everything. Do we remember what type of services that Medicare will actually cover? The specific long-term care. Well, basically, yes. The long-term care services will be paid for mostly Medicare and Medicaid. But Medicare really is kind of picky about the different things that they will be willing to pay for, and so the things that they're willing to pay for will be those that have to do with any kind of medical thing, hospitalization, and rehab. So mostly those type of services within long-term care. And then of course there's Medicaid, which pretty much covers a wide range of different services that are offered in long-term care. And then there's going to be private, other sources, and some other public funding is available as well, like the Older Americans Act. They block grants that are given to the states, and then the states can kind of disperse them into whatever programs that they have available for the seniors. So, okay, number 2, what are evidence-based practices and why would we want them implemented in our long-term care? Go ahead. Anyway. It's up to you guys.
So evidence-based practices are those that have, I believe it was scientific evidence that have proven results that the services are efficient at restoring someone's health. So they would rather use that than use something that is just assumed or believed to be helpful.
Right.
Evidence-based.
Yeah, that's a perfect answer, of course. Also, you guys, I will give 1 point for every question that you guys answer of extra credit. Okay, so I'm keeping track of who's saying what. All right, so question 3. We still have many uninsured adults in the United States, and many of them are unemployed. So why, are employed? Many of them have jobs. Okay, so why would adults that are employed still not have health insurance? And what happens to the population as a whole when less people have health insurance?
So some reasons why people can be employed but not have health insurance are because they're part-time. Like I'm part-time and I don't have health insurance through my job, or their job doesn't offer it.
So yeah, like some jobs, they don't necessarily offer, yeah, you're right. They don't necessarily offer any kind of health insurance. And reasons, do you know the reasons why they wouldn't offer?
Maybe because they're like smaller businesses and can't really afford to pay for that. Like
Yeah. Yeah, that's true. I mean, really, if you're a business, you're only required to provide health insurance.
Did we lose her?
I think we did.
I think so.
Are you talking about you losing me?
Yeah, there you are.
I'm here. I don't know why it's doing anything.
Can't really hear you.
Technology.
Okay. Is it a little bit better now?
Yeah.
Yeah, I saw my signal go up again. Okay, maybe I'll be okay for a while. So yeah, if you don't have 50 or more full-time employees, you don't have to offer health insurance. And another thing that some, companies will do is they'll, just because of that reason, they might try to have way more part-time employees compared to full-time employees. Okay. So anyway, what would happen to the population as a whole, do you guys think, when less and less people are having health insurance? Think in terms of like even COVID right now. If less and less people have health insurance and more people are, infected, what's going to happen?
They're not going to get treated.
They're not going to get treated. It's going to be passed on, a lot more, a lot quicker, right? Things like that. Okay, so question number 4, what are some major consequences of not having health insurance? And that's kind of like number 3 as well. We kind of answered part of that. Anybody?
More health complications, diseases, and possibly death as well.
Yes, absolutely. Yeah. So, and overall, I mean, our country's health status of our population would reduce, right? We would not have, we wouldn't have great health in this country, or satisfaction with the health system here compared to what, other countries have. A lot of other countries experience high levels of satisfaction with their health system because, they have health insurance. They focus a lot on primary and preventative medicine instead of how we do it here. So there's that as well. Okay, so number 5, what is a peer review organization?
To review care that's been provided to Medicare patients.
Is this, say that again?
Like, so they can review like how patients were treated, like through Medicare and stuff.
Yes, that's it. Yeah. So, peer review organizations, you have it. I do want to ask: are these government enterprises or are these private organizations that are funded by the government?
I don't know.
Okay, they're private organizations, and usually the ones who are doing the peer reviewing, they're either physicians or they're going to be like, nurse practitioners or something like that, and they're subsidized by the government, by the federal government. Okay, but they're, they're usually private enterprises, private businesses. Okay, number 6. Describe 3 types of case managers involved in long-term care case management. You guys can pull up your homework assignments too. I'm back. Okay, number 6. Whoever's ready, go ahead.
Okay. So 3 different types of case managers. Are you talking about the models?
Yeah.
Okay, perfect. So the brokerage model, those are freestanding agents, which will assess the patient's care, and they'll make referrals based on that. And this requires very little involvement from them. Then you have the managed care model, where the case managers are part of the managed care plan, and they'll make referrals based on whatever guidelines have been established by, or whichever guidelines the managed care plan follows.
Right.
Then you have the integrated model, which is also known as PACE, and that focuses mainly on the frail and elderly patients.
Yes, absolutely. Good job. All right, thank you for that. Number 7, what are ways that medical expenditures increase?
Aging population, growing population, changes in disease prevalence or incidence.
Say some of that again. All right.
I got aging population, growing population, change in disease prevalence or incidence, increases in how often people use healthcare services.
Right. How often people use healthcare services. That's true. What about also expansion of health insurance? The more money we spend on, the growth of medical technology as well. That would be something that's going to help, increase our medical expenditures. Also, just having a system where we have so many different healthcare plans, health insurance plans, and managed care plans and whatnot, and a lot of the administrative costs that are associated with those as well would drive up costs, things like that. So, okay. All right, let's move on. Good one. Okay, number 8. What has the ACA's main focus been in healthcare delivery? What's been the Affordable Care Act's main focus in healthcare delivery? Was it to
healthcare?
Access to healthcare? Yes, access to healthcare. Yeah, that's really it. Okay, number 9. Explain the pay for performance model. This is a good one. Go ahead.
Is it also known as value-based purchasing? It's a payment model that offers financial incentives to physicians, hospitals, medical groups, and other healthcare providers for meeting certain performance measures.
Yes, absolutely. If we get a little bit deeper into this, there are kind of 2 different ways that they do this as well. So there will be the quality value-based reimbursement or incentive, and then there's one for quantity. Okay, so if we go a little bit deeper, you can kind of see how that might play out. If you're focused, if you're going to be paid more based on like the quality of the healthcare outcomes of your patients, you might be more focused on taking care of those patients that you know you can help, that you know you can help cure them or get them better in some way. And then there, on the other side, there are value-based incentives on increasing the quantity or the volume of patients that you see. So those physicians who get paid based on that type of a value-based reimbursement system, they would focus a lot on just turning out patients. seeing as many as you possibly can. Okay, because you know you're going to get more money once you hit a certain quota, or you know, whatever. But Medicare is trying to focus more on a pay-for-performance model that would focus on the quality of care being provided to the patients. So there's that. Okay, number 10, what is the Office of Women's Health, or the OWH, and what are a few things that they focus on?
So the Office of Women's Health is dedicated to evaluate disease and disability of women. So they will establish a protocol, and they have an agenda to promote research, service delivery, and education with the various public agencies across the states, just to promote overall women's health.
Right. There are a few cool things that they have sort of put a lot of energy into. One of them would be breast cancer awareness, and also being able to provide like free mammograms and whatnot to patients. So they have tried to put a lot of energy and money into that. And also I know that they have focused a lot on like substance abuse, and also battered women or domestic abuse victims and things like that. So, okay, question number 11. What are the two main public health insurances in the United States, and when were, or what year were they legislated?
Medicare and Medicaid, and they were legislated in 1965.
Yep, there it is. Thank you. So we had Medicare, Medicaid in 1965. That's what it was. Okay, number 12. What are some ways that healthcare costs can be regulated?
Could you repeat the question one more time?
Sure. What are some ways that healthcare costs can be regulated?
Price controls, health planning, single payer systems.
Having a single pay. Yes, all of those are perfect answers. I want to ask you guys a question really quick. Can you guys see the screen? Or has it disconnected from screen share?
We can see you, but we can't see your screen.
You guys can't see I thought you guys could see the screen the whole time.
We see you, and then we just see all the names of the who's in attendance.
Yeah.
Oh my gosh. I thought you guys could see this the whole time, and I just barely thought maybe there's a reason why. Okay, here it is. Last few questions. Okay. So number 13, defining access to care, or define access to care. So what does that mean, having access to care?
The ability to get access to healthcare services in a timely manner.
Exactly. Good job. Okay. So number 14, anthrocultural forces seem to influence a lot of healthcare delivery in the United States in many ways. So what are those anthrocultural forces?
I was kind of stumped on this one, but what I found was anthrocultural is in regards to their belief system. And so what I wrote down for the homework was that they will establish or push legislation that is in line with their belief system, as opposed to pushing something that they're not in agreement with, but I'm not sure if that's accurate.
Yeah, I mean, that's kind of like the basic concept of this whole idea of anthrocultural forces. But so this is like this, what we're referring to in this question is like the anthrocultural forces, or the collective belief system that we have in this country. So as Americans, what are our collective beliefs that we have, that we share, that influence how healthcare delivery works in this country? So some of those like anthrocultural forces could be we don't like the government getting involved in controlling things. We don't really like taxes. We don't like increases on taxes. Also, we believe in science and capitalism and entrepreneurship and things like that. So those ideas that we kind of share as a collective really influence how our healthcare delivery system works. Okay, does that make more sense?
Yes.
Does that help? Okay. Okay, so number 15. What kind of condition is AIDS, and what is it considered to be now? Oh, what kind of condition is AIDS considered to be now? Sorry. Go ahead.
A chronic disease now?
Yes, it is now considered to be a chronic disease, which means, it's something that we're going to have to live with forever, but we're able to maintain it. Okay, and we can live a normal life instead of having too many flare-ups and things like that. Okay, so number 16. What are the main factors that cause managed care to grow, and why did it initially receive so much backlash? I mean, I know it's kind of a long story, but you can give me some highlights.
Didn't it grow because of the cost and the quality, and it backlashed because employees didn't see lower out-of-pocket costs?
Let's see, well, it grew in many ways because, let's think about when it kind of really took off. It was like the 80s, right? The late 80s and whatnot, and the 90s. And yeah, like you said, it had a lot of backlash because of, really it was because they were so strict, okay? Managed care, they were very, very strict about their usage, the utilization of their healthcare resources and things like that. So they didn't really want their beneficiaries to be getting services left and right. They didn't want them staying in the hospital for days if it wasn't necessary and things like that, right? So they were very strict, and they put a lot of regulations on the healthcare services for their beneficiaries. So that's one reason why they had so much backlash initially. Now, the factors that allowed managed care to grow, well, there's kind of a variety, and it's a very long story, so I encourage you guys to rewatch that video. But some things we can bring up are the fact that a lot of employers, they were kind of sick of like the higher, I think you mentioned this, the high out-of-pocket costs of the private insurances that were available at the time. So a lot of these employers were really frustrated about not having quality care for their employees, but yet they were so expensive. They kept increasing the premiums and whatnot. So managed care came along and was like, hey guys, I can offer you great quality care at a very low cost because we have cost control. Okay, so that's one reason why they grew. Another reason that allowed managed care to have so much leverage in the industry during that time was because during this time, the group practices, the small solo practices, and the clinicians, not necessarily the hospitalists, but the ones who had their own like clinics and their own practice, those guys economically, they weren't doing so well because the hospitals were kind of, you know, the hospitals were switching over their whole system to treating outpatient care, and they focused a lot of energy and money on outpatient care. So when they did that, what type of services do these private practices offer? Outpatient care. Okay, so the hospitals were sucking away a lot of their business, and they were economically disadvantaged at the time. So a managed care came along and said, hey, we have patients for you. If you sign our contract, we'll give you patients. These physicians and private practice owners and whatnot felt like they didn't really have a choice. So they had to go ahead and sign on with managed care. So those are two huge reasons that allowed managed care to explode, to get, you know, so much business during the time. Okay. Okay, so number 17, what are the different types of NCOs or managed care organizations? And we only discussed two major ones. So go ahead and give me those two.
HMOs and PPOs.
HMOs and PPOs, yes. Okay, what are the different types of HMOs?
Staff model, group model, and network model.
You said staff model and group model and then network model?
Yes. Yes.
Yes, those are the ones. Good job. All right, so we answered all of the review questions. Do we have any questions or is anything unclear about what's going to be on the quiz? It's pretty much going to be this stuff, but I'm really, really sorry that there was no Kahoot. I don't know what happened there. So it's probably something I did. I'm sorry. But at least we kind of reviewed it this way. I hope this helps you guys. And I will also have a recording of this and post this on YouTube and give that to everyone so you guys have this to refer back to just in case you need it when you're taking your quiz. But before we close out, does anyone have any other questions or anything like that that wasn't clear in the material that you want to go over?
I just have a question about the due date for the paper and presentation. It's on the 1st, correct?
I believe so, yes. Let me actually go really quick and take a look at this because it kind of seems like it's happening too fast. One second, real quick. Okay. I'm looking at the syllabus right now, and I know that I put Zoom meeting down on the 1st and the 3rd because the idea was that we were all going to get together and you guys are going to give live presentations. We're not doing that. So given that that is the case, we can have the paper due June 3rd. We can just push everything to June 3rd. That way you have 2 extra days to get things done and send your presentation to me that way as well on that day. Okay. So June 3rd is when everything will be due, and then June 8th is when we're going to have our review, and the final exam will be put out there on that day, and you'll have a few days to take it. So that will be it. We're not going to do any kind of Zoom meeting for the presentations on June 1st or June 3rd. You're just going to send me your presentation and you're going to send me your paper. There should be already a link on Blackboard for you to be able to do that whenever, you know, it's due. And if there isn't, please let me know so I can change that, or I'll check it as well right now. But yeah, so the due date, the official due date will make it June. Actually, How are you guys doing right now on your presentations or your overall project? So if we're not actually aiming for a day to present, we can push the due date a little bit further, but how are you guys doing? Do we want
like an honest answer?
What was that?
You want like an honest answer?
I want a very honest answer.
Okay, I haven't even started.
Oh,
Yeah.
that doesn't feel bad at all.
I have like 3 other classes, I'm sorry.
Okay, you guys really, really, really need to start, because if it was due by June 1st, you have a couple days. You need to
I promise I would have gotten it done.
What was that?
I said I promise I would have gotten it done by the 1st.
I mean, I get it. I'm really good at getting projects done in one day as well. So I based my whole college career on that. So I know how it is, but it's also not safe. That is the danger zone. So you probably don't want to do that. That being said, we can actually push the due date a little bit further. Since we're not having to do any kind of live presentations, so that I can give you guys a little bit more time to get things done. Although I do want to make sure you guys have plenty of time to review and focus on the final exam as well. So what we can do is change the due date to June 5th for everything. But we have a few more days. Does that sound okay?
Sounds awesome.
Yeah, that's great. Thank you.
Okay, no problem.
Thank you.
That will be the new due date, June 5th. But you guys have to start working, because there's nothing after that. We can't push it further after we do that. So that is absolutely the last day, but hopefully you guys will get it done. That being said, if anyone needs any Okay. Wait. Okay. I guess that's it, guys. I don't know why it keeps cutting me off right now, but we're pretty much done with everything for the day anyway, so we'll just leave it at that. So I'll just go ahead and close it out. But if anyone has any kind of questions, concerns, or anything like that, please contact me through email and we'll get it straightened out. Okay? Other than that, we'll have a great day, and I will go ahead and post this recording on YouTube and get it sent out to all you guys. Okay? Good luck on your quizzes.
Thank you.
No problem.
Bye.
Bye.